and this is on exercise and MS. And this is a how-to approach and the benefits that you can receive. So I'm going to do a brief intro to this, and then I'm going to turn it over to our expert in this area, Dr. Alyssa Husted, who is our lead MS neuro-PT. Please, if you need to, I know this is a whirlwind tour of information, get up, use the bathroom, get snacks, feel free to do what you need to do. And then at the end of our 4 talks, we're going to have time for a question and answer. So why do we talk about exercise? If you come into the clinic, you may wonder why we're always asking, are you exercising? And sometimes I think when people tell me that they're fatigued and then I say, are you exercising? They probably want to throw their purse at me or something, which I would too. But we talk about it because it's very important for your overall health with MS, and it's also very important to maintain your physical function, and it has significant impacts on your overall neurological health. So you can see on this slide these diverse impacts that it has. What's really interesting now in MS research is that we're starting to collect data that shows that exercise actually directly impacts your brain health. It is neuroprotective. It can fight back against neurodegeneration or dying off of neurons. We have this amazing part of our nervous system called neuroplasticity, where if we've lost function or we have decreased function, we can try to make new connections through exercise. One of the biggest challenges in MS is physical disability and cognitive disability, and exercise can help both of those. In fact, I think it's the best treatment to maintain people where they are or to try to improve while also taking a disease-modifying therapy to prevent worsening of the disease. So these are those main points that I'm talking about here, just putting it in, that exercise is key for brain health. We want you to do well, and taking a medicine to fight MS is incredibly important, but this, I think, is equally as important. There is a very comprehensive approach to leading to the best outcomes in MS, and so we're really lucky that we have an incredible neuro rehab team here to help you with that, as well as a neuro wellness center. So just to hone into this a little bit further, when we have physical inactivity in MS, it can kind of be a vicious cycle like you see here in the screen. If you have MS and then you develop fatigue and then you tend to not be as physically active as you might have been before, this can lead to further decline. Sometimes people will come into clinic and they'll say, I think that I'm getting worse. And we examine them and we say, I think you're right, things are changing. And we talk and we find out what's going on, and they say, I've just been feeling really fatigued, and then I didn't really exercise, and I've kind of been sitting around a lot more, and I just don't feel good. And we find that it's not that the disease itself is causing new damage, but that it's actually that they're that lack of activity, they're losing function. We call that deconditioning. So we know that if you look at your right-hand side of the slides, that these are all the symptoms that exercise can impact. So we can reduce fatigue. Initially, you might feel a little more tired, but we can improve that. And then we want to also comment on the importance of exercise in reducing mood disorders, depression and anxiety, and also improving cognition. So I'm going to turn it over to Dr. Alyssa Husted, and thank you.
Thank you. Well, my name is Alyssa Husted. I'm a neuro-PT at Ohio Health's Neuro Rehab in Upper Arlington, and I'm also in the MS clinic 1 day a week, so some of you have probably met me. I have my undergrad from Miami University, as Dr. Nicholas did as well, and then I have my doctorate in physical therapy from Ohio State. So as Dr. Nicholas said, she tells people to exercise, and she'll pull in one of the neuro-PTs that's there that day, and this is often what I will go through with people, so I thought this is what I will share with everyone today. So how to start exercising if you're not, or how to be more consistent if maybe you're just not doing it regularly and that fatigue is really getting you, or we don't have the motivation, or we just don't want to. So number one, identifying exercise you'll enjoy. If you are trying to do something that someone tells you to do or you don't enjoy it, you're not going to do it, or not for very long. So this could be exercise at a gym, whether you're using gym equipment for like the cardio machines and strength machines, or it could be doing the group classes. This could be at a fitness facility close to your home. If you're near this area, the Ohio Health Neuro Wellness Center, where the exercise physiologists are all educated in neurodiagnoses, including in MS. And then also the Franklin Park Adventure Center, which is a free fitness facility closer to the Franklin Park Conservatory downtown. Sometimes people are like, I don't want to go anywhere, I'd rather be at home. So everyone loves their PT/OT exercise handouts that they get in therapy. But that's a joke. I typically recommend doing something else in addition to that because those tend to be monotonous and you want some variety. So there's also exercise videos online and exercise apps or getting outdoors. So group exercise classes, obviously picking ones that you are interested in. This could be yoga or chair-seated yoga. For modifications, water aerobics, a lot of people enjoy. Cardio drumming, which is what that last picture is with the drumming on the Theraballs. So this is more entertaining often with music. There's a group setting, you meet people and you're always meeting your friends there. Tai Chi or any type of Zumba or dance exercise, boxing. And then the thing that I also tell my patients that I'm working with, if you're going to these group classes, just keep in mind, you may need to provide rest intervals for yourself, or maybe, especially if you're starting out, maybe you only do half of the class. I have someone who loved her water aerobics class, but she was scared to go back, and I said, why don't you go and maybe you just do the first half, but take these breaks. And she built her way back up to her full class, and if she has a hiccup, and then she has to work her way back up, and that's fine. Just tell the instructor so they don't worry about you, or give them a heads up. But yeah, the group classes are great. Exercise videos on YouTube. So sometimes you're like, what do I do? Or you want variety. So YouTube is great, but you also have to be careful what's out there. That's why my disclaimer is select videos appropriate for you and modify as needed. So this is also when, talking to your physical therapist or neuro-occupational therapist to help you identify ones that would be safe for you. The top 3 are ones specifically made for people with MS. The Multiple Sclerosis Foundation has a channel. They're Tai Chi, gentle movement, and I'm forgetting what the last one is, but it looked like 3 different types of classes. And then Chair Fit with Nancy, she has more modifications from a seated level on her exercise videos. And then the MS Gym has a few videos as well. HasFit is one that we are loving to tell people about in neuro rehab. If you go to the type of workout program, there's, I typically have people start with the senior workouts, even if you're not senior, only because they have someone standing and someone sitting, so they provide good modifications. And again, you can stop the video and take breaks. You can not do the whole video, but picking ones that are appropriate for you or skipping an exercise if it's that one exercise isn't the best. And the same thing with Yes to Next. It's a woman and her mother doing the exercise, so the mother does the modifications on the exercise, but it's just providing more variety. So looking at exercise apps, if anyone knows of MS ones, please tell me, but because I will say the Fit On and Nike Training and Map My Fitness are probably all higher level, so probably people with minimal to no physical impairments would maybe do those, or definitely pick seated options or exercises that would be appropriate for you. I added the Tabata timer only because if you have exercises that you already do or that physical or occupational therapy gave you, there's so much research on interval training in MS, so that already sets it up you're doing exercise for 30 seconds and then you rest for 20 seconds. So then you're not continuously stopping your timer or watching the clock. It already shows up there for you. But your therapist can help you figure that out. And then getting outdoors, sometimes that's more motivating to get our vitamin D in the sun. Obviously keeping in mind heat and cooling strategies, but it can be more enjoyable to maybe go on a walk in the neighborhood with a family member or friend, hiking in the park, riding a bike or a trike, which is in that picture on the screen, playing tennis or pickleball. I'm hearing a lot of people playing pickleball, golfing, or Ohio Health's For Hope program. And then also Adaptive Sports Connection, which is located in Powell, but I believe that they do their activities in different areas around Columbus. But say you used to be a kayaker and now you're like, I just do not feel safe doing that, I can't do it. They have modifications and they help you out to still access those things. So they also go skiing in the winter. They help with the biking too, and they have that equipment. So then you're not making this big purchase and then you don't like it. So they're great, and you can check out their website. Next, I think it's helpful, I say this to people, like, what is your motivation or your goal to exercise? If you're just like, I'm just doing this because I'm told to, like, that also probably isn't the most motivating to you. So oftentimes people want to increase strength, energy, or their balance, but like, what do you want to do with that strength, energy, or balance? I think that's a big goal that we hear in physical and occupational therapy as well, is like, yeah, but what do you want to do? Like, I want to help you get back to those things. So I just put a few examples. A lot of times it's, family related, or going to their kids or grandkids, like sporting events, or just getting on the floor to play with them, traveling or going hiking. It could be anything. It could be going to the grocery store, literally anything. So as I said, when people are in the MS clinic and we're like, hey, you're not exercising, it seems like a big thing. Literally start small. We're not going to jump into what like the exercise guidelines are for MS. Pick one day that you are going to exercise and pick a doable amount of time that you're like, I could successfully do 15 minutes. Like, I don't care. Pick what you're going to be successful doing. Assess your response afterwards. So you're probably not going to push it too hard if you haven't been exercising, but if it's overly fatiguing, that's also not going to make you want to keep going. So thinking about, am I better or the same after 2 hours? If it's completely wiping out your next day, then probably modifying what you're doing, or seek help from your neuro PT. I'll keep plugging it. And then progress from there. Another good idea is to exercise when you have the most energy. So some people are great in the morning and then, worse as the day goes on. Some people are like, I am not awake in the morning, I need a little more time. So maybe the early afternoon is a better time for you. If someone's working 40 hours, that takes a lot of energy. So maybe starting off exercise on the weekend, a day off, as opposed to thinking you're gonna fit that in after work. You're probably not gonna want to once that time happens, but you can ease into that later. And then also thinking about how appointments and errands are taking some of your energy too, especially if you have motor fatigue, that could already be wearing you down. So exercising right beforehand, think about how you're spacing and timing things out. And then again, if you're wanting to be physically active outdoors, think about times when it's cooler, or definitely using your cooling strategies. Then we want to stay accountable. I think this is important to everyone, obviously, with exercise. Exercising with a buddy makes things more fun, and you can hold each other accountable. Sticking to a routine. Say you always exercise on a certain day at a certain time. It's like having an appointment with yourself. So scheduling it, using a calendar, reminders on your phone, which are easy to ignore. But also, like Alex said, having Alexa remind you, I don't know, whatever works. And then if needed, neurophysical therapy and or occupational therapy to the rescue. So we are helping you, we're prescribing exercises to help you with your individual impairments, but also we can help you create your program for exercise to, be hitting all the different areas that you need. And then especially if you're starting off, like helping to monitor your response or modifying exercises and, whatever you need to make it for you. So these are the recommendations for exercise in MS. So with aerobic or cardio exercise, we want to work up to 2 to 3 times a week for 10 to 30 minutes. So that again can have intervals. You can build up or break that down into different segments. Strengthening exercises can be using TheraBand resistance, those stretchy bands your therapists give you, dumbbells, it can be body weight, or it can be those strengthening machines at the gym. And a lot of these things, may cover a lot of them in those different classes or videos too. Also, what I say with the strengthening is maybe like your weaker side, weaker arm or leg wouldn't do as many reps or as many sets as the other one, but alternating sides, alternating muscle groups so you're not overly fatiguing one part of the body. Stretching, active range of motion, all of that is great to do daily. At a minimum, that's what you would be doing. Really focusing on the muscles and the joints in the body that are tight or have spasticity, but full body movements is also recommended. Stretching is the exercises that you're going to the point of stretch, no pain, this should not be painful, and holding for 30 to 60 seconds and then repeating that, 2 to 3 times. Balance, I think this is a good thing to get from your neuro PT because then it's what's appropriate for you. 20 to 60 minutes, 3 to 6 times a week seems like a lot. So I often recommend doing that at certain times of your day. You're already standing in the bathroom near a counter or at the kitchen waiting for your coffee. You have a safe surface, things like that. So fitting it in throughout your day makes it a little more doable. So try this. I've mentioned some of these along the way, but rest intervals within the exercise session, breaking up exercise throughout the day, definitely prioritizing safety to reduce injury risk. That's why I really stress picking exercise that's appropriate for you and modifying if needed. Cooling strategies and products. At a minimum, drinking cold water beforehand or cooling towels. Some people think that heat doesn't affect them, but exercise increases the internal body temperature and it could, help with that motor fatigue or what you're feeling when exercise, can wear you down, wear you out a little bit. Planning for times a day you have the most energy and then considering that 2-hour rule, so not completely wiping yourself out the next day. Again, reminders, keys to success. Pick exercise you'll enjoy, identify your goal or motivation, write it on your bathroom mirror. Start small and slowly progress, and then find a way to hold yourself accountable. And then we also wanted to just, since everyone's at different, ability levels, we want to make sure I'm pointing out some specific examples. So if you have minimal or no impairment, a lot of the things that I recommended are on this screen. Road cycling and hiking outdoors would be higher level things. Running, swimming could be all aerobic exercise. And then flexibility training can even be like the yoga too, which yoga also, helps with neuromotor and strength as well. And then if you have some walking impairment, so maybe you're at risk for falls or using an assisted device to walk, also making sure you're exercising your core. So I think this is important for everyone, but at a minimum, having postural exercises where we're engaging our back and core muscles is great. And I also like more neutral trunk core strengthening, especially because bone health is so important in MS. So if you do have like a bone loss condition, you wouldn't want to be doing like repetitive crunches. That's not the safest way to be strengthening our trunk. And this is very similar as well. So we also just like sit to stand exercises. So things that are functional movements is great because we're like training for the activity we want to do. So we don't want to have trouble getting off our couch or out of the car. So doing that as an exercise. And then also these are some ideas for maybe you are using your wheelchair all the time. So again, those postural exercises. And oftentimes people don't think of breathing exercises as something that they would do. So this is something your neuro PT could help you with, but we want to strengthen those respiratory muscles. As we're not moving as much, that could be affected. And again, the seated exercises and even propelling the wheelchair is also, a form of cardio and strengthening as long as we're doing it correctly. And again, if you're spending more time in bed or in the wheelchair, definitely focusing on stretching exercises. And if someone needs to help you, that is something that neuro PT and occupational therapists can help with. with training your care partner for doing appropriate exercises to help with stretching and range of motion. And again, the MS Center team.